Hey, everybody, welcome back to the Modern Customer Podcast. I'm your host, Blake Morgan. My next guest is Sri Narasimhan. He is the head of enterprise customer experience at CVS Health. CVS Health has over 300,000 employees. He is driving a meaningful organizational change based on customer, client, and patient feedback. Sri is passionate about advocating for consumers and is dedicated to creating a customer-centric culture at CVS Health. Prior to CVS Health, Sri was head of customer experience for branch banking at Wells Fargo and was the head of analytic consulting for Medallia. We're going to be talking about customer feedback and how to create a very meaningful customer feedback program. We're going to be talking about all things feedback, including moving more toward signals versus surveys, proactive versus reactive, and so much more. Please enjoy Sri Narasimhan. Sri, welcome to the Modern Customer Podcast. Where are you calling in from today?
Thank you, Blake. I'm in Chicago, Illinois, so just outside the city.
Oh, perfect. Yes. I'm watching a sci-fi show right now about Chicago called Dark Matter, and
Oh
I'm
yeah,
seeing
on
a lot
Apple.
of Chicago. It's very exciting. Have you seen the show?
I have actually. There's another one on Apple. It must be a thing they're doing. It's called Presumed Innocent, also set in Chicago. Yeah,
Oh, yeah, I've heard that's
yeah.
really good.
It is. It's good.
Awesome. Well,
Yeah.
yes, a lot of good shows. Interesting, like some really new, interesting concepts. But anyway, let's get to customer experience. You are the perfect person to be on this show because you have such a wealth of experience. You worked in Medallia, you've worked in finance, now you're at CVS on the forefront of all things customer experience. I mean, let's just talk about how you got onto this path of customer experience, digital, and I would say analytics.
Yeah, it's interesting. I think about it all the time. I came from a family of scientists. Like my mom's a nuclear engineer, my dad's a physicist, and I think they ask me the same question all the time. How did you get into space? I think they think it's a soft science, As you know from your research and all your work, there's a lot of really hard quantitative data behind how we treat our customers and the value it creates. So earlier in my career, I worked as an economist. So a lot of my time was spent studying consumer behavior. And one of the things I pretty quickly realized is the way loyalty and these aspects around how you build seamless experiences and access to your services is really how you grow a company. So, I worked at companies like GE early in my career. I worked at, as you mentioned, Medallia, and I just learned the importance of this. And I've had the opportunity to then lead these organizations that focus on how you treat your consumer. And I think that what's been really unique for me is seeing the discipline shift from being this kind of fuzzy, like, hey, it's how you treat folks and just being nice to people will lead to these great outcomes to like more of the quantitative discipline it's become to really understand that effectively consumers are a mirror. So they will show you your inefficiencies. And if you're listening, if you're paying attention, you can leverage that to really improve your business, not only from the aspect of improving the consumer experience and making them more loyal, but actually just identifying opportunities where you need to perform and operate at a higher level. So it's been a bit of a journey. I definitely started in like a very quantitative discipline and kind of brought it over here, but I think that's frankly where CX is going. It's been fun to be part of that journey.
Could you just talk a little bit about your time at Medallia, if you don't mind, just like the insights you got into? I mean, one of the things you wanted to talk about today was just, I think you called it signals. So just like looking the whole discipline of analytics, moving toward signals versus surveys, proactive versus reactive. I mean, what did you learn there that you're now applying to what you're doing today?
Yeah, so I led the consumer insights function at Medallia. So basically, we did insight consulting for all of the software clients at Medallia. And I think one of the things I observed is people were very focused on running a survey program and not a consumer experience program, if that makes sense. So every time you were talking to someone about like, hey, what are your consumers are telling you? It would all be like, well, our surveys are telling us X, Y, and Z. And that's a really important part of data. So like what you're implicitly hearing from your consumers is really important, or explicitly hearing from your consumers is really important. But I think what I was learning there is that there was this whole other universe of information and data available where you could actually just observe the experience someone had. Like I know Blake called our call center, was transferred 3 times, and was on hold for 10 to 25 minutes, whatever it might be. I don't need to say, hey, how was that experience? How did that go? I know already, right? Like I know it was terrible.
Yeah.
So can we just, why are we living in this world where we're waiting for her to tell us? And I think that was one of the things that, I observed is people wear that badge of honor. I'm like, we run a huge survey program, really important source of data, not belittling that, but there's all this other information available to us that we need to evolve to understand. That's what we're doing at CVS. One of the things, a couple of things we've implemented, we're looking at digital session data and how you actually track on our websites in terms of where you click, where you go. Are you rage clicking a button? Are you birds nesting? And then seeing if you could
What is
actually,
birds nesting?
it's where you actually make a bird's nest with your mouse. It's a real term. I didn't know that
Oh,
either.
okay.
um, but can we actually, then do you actually call the call center after that? Can we look at your call transcript and just see like, hey, we can see that she's using a set of words and tones that make it clear that she's unhappy. And if I can get to that world of understanding you without having to ask, then my survey program actually becomes way more effective because it can be way more targeted. Because I don't need to use it to ask for like just your core experience, the one that I already should know. So in a way, it's creating more personalization. It's showing you I understand you more, and creating an environment where I can act more effectively on your feedback. So that's where I'm trying to shift our thinking is let's use that, leverage that data, and then the proactive versus reactive part. I don't want to have to ask you. Like, I want to just be able to say, like, hey, I
Yeah.
know that didn't go well. What can we do to make it right? Or even better, can I orchestrate it from the beginning to make it better in the moment, right? So you don't have to wait. And I think that's just where I see this all evolving as we move forward.
So, Sri, let's talk about what you're up to now. And your title's interesting. It's head of enterprise customer experience. So, could you just share with our audience what your scope is?
Yeah, so at CVS, we have our retail business, which is all the stores which you've probably interacted with many times. We have Caremark, which is our PBM, um, with pharmaceutical benefit management. We have Aetna, which is the health insurance arm of our company. And then recently we've acquired several businesses that are our primary care businesses, Oak Street, and then Signify, which is focused on home visits. So my scope is I cover our experience measurement and insights for all of those lines of business. So I'm responsible for the 18, 19 million pieces of feedback we get from our survey programs, our social media data, those signals I just talked about. How are we actually acting on that feedback to improve the experience for consumers, to improve operationally across our businesses? And then how do we embed that in our culture? Because I think we have a vision to be
Mhm.
the most consumer centric company in healthcare. What that means to me, Blake, is I want to live in a world where if I told you tomorrow CVS wasn't going to be around, it would devastate you. I want to create that sort of company and that sort of experience with our customers where you can't live without our brand. And I think taking all that feedback, all this different information we're getting from our consumers, and making sure we're showing them we are acting on it and that we're truly trying to improve the experience is critical to that.
And they say that Sri, customer experience is a game of inches rather than yards. That's a Forrester quote I really love. If it's a game of inches rather than yards, I mean, what are the inches that you're looking to move the needle with?
Yeah, I mean, wow, that's a really, I love that question because I do think there's an aspect of the customer experience where you try to do too much, and you really try to go right to like, let me just scrap everything and start from the beginning. And as a huge company with the scope like this, I think it's really hard to do that. I'd say a few of the things that we're looking at right off the bat is just, I'll give you a couple. One, how do we better leverage the information we're getting from our consumers every day? And I've already kind of talked about that. The second is, how do we start making that transition to proactive? And I'll give you a really tangible example. We know when someone's a first filler at our CVS, that's a really important experience. And if we fail there, chances are you're going to go to a different pharmacy or you're not going to come back. So we know when you're a first filler. I know things like, did you actually have a challenge with your copay? Was there an out of stock? Um, did we miss our promise time? So we have actually tracked that, and we're testing this right now to understand operationally you've had a challenge. We're now proactively outreaching to consumers in a test environment right now just to make sure and see like, hey, we think that was a bad experience. Here are some options to make it better. Like, can we, we have options like delivery, switching into 90-day fills, things like that, so we can actually proactively get you to a better experience right away. That's moving the needle
Mm-hmm.
on, hey, let's go to proactive. And then we want to take that journey to eventually orchestration. So can I even intercept you in the store and things like that? But that first inch is, can we even get to the point where I can actually say, I don't need Blake to tell me it was bad. I know. And then beyond that, can we do something about it? I think that's one really critical way we're trying to do that. Doing some similar things in our call center as well, but we're trying to take that first step into that proactive range. I don't think anyone, I don't know, you talk to so many people. I love your podcast. I don't know anyone who's cracked the nut on doing that. I think people talk about it a lot, but it's a really hard thing to execute. So that's where we're starting to take our first steps.
Yeah, I would say that healthcare, it's going through so much change right now. And the consumerization of healthcare is obviously, or has been for, part of a big discussion for many years now, where customers expect the same experience from, CVS as they do, where they buy like a blouse or their dog
Sure,
food
absolutely.
or deliver their food. So, considering the consumerization of healthcare, is there a vision you can share with us, like even beyond what you just shared, about what you're trying to achieve, considering all these changes happening?
You know, I, I feel like I should steal your line because I say it all the time. You said it better than me. I say it all the time. Like, you're not competing with, like, no one's like comparing Aetna to Cigna. They're comparing it to like Amazon. Like, it's like, you have to be,
Yeah.
or they're comparing it to like the best company they interact with. I'd say that the way I describe what the problem is, if you think about what a consumer wants in healthcare, it's really simple. Is it covered? What does it cost? When am I going to get it? And can I trust you? That's it.
Yeah.
Can I trust anything you just told me? And any other industry, the answers to those questions would be really easy. For whatever reason, because of the US healthcare system, the way it's designed, the number of stakeholders, and the complexity involved, getting those answers is really difficult. Your consumers don't care. Because they're not used to that and they want to know, like, hey, these are really simple questions. Why can't I get simple answers? So I think the vision I have for the company, and I think it's shared by Michelle Peluso, Karen Lynch, others, is we don't want consumers exposed to that friction. Like, I hear it all
Yeah.
the time in our patient advisory councils. People want someone who's on their side as they go through this journey and through this process in healthcare. These are really emotional journeys. It's not buying a blouse. It's like my kid's mental health, or like my spouse needing treatment for oncology, things like that. But
Yeah.
we need to make that exposure to friction reduced and take advantage of this whole enterprise set of assets that we have to make that journey as simple and straightforward as possible. So there's not all of those moments of friction that are inherent in the system. We reduce your exposure to that. I think that's what we're trying to build. And
Hmm.
we're trying to do that through digital assets and improving the experiences in our call center when you do have a problem. But like that's really the focus, is how do we stop getting all of these patients and consumers exposed to the complexity of the US healthcare system, if I were to say it in a nutshell.
Yeah, I love that because it's almost like get your house in order. It's like people don't care about your drama. They just
Exactly.
need the help.
That's totally
And
right. Yeah.
if you get your house in order, like you're just better able to serve others and not bother them with your drama.
Yeah. Because I mean, you don't, you're totally right. Again, the consumer doesn't care. They're just like, tell me, when am I going to get my prescription? When can I see this doctor? They don't want to know that there's 900 processes behind it. So, Totally right. I think that's what we need to solve, and it's a hard one, but I think that's the gap to fill.
Do you think that you have a particularly difficult challenge or mountain to climb considering you have so many businesses under the CVS roof that are so different, or do you think that it's not a problem to apply your customer principles across and create that culture?
Well, I think that the execution of the strategy is critical for our success, and bringing these assets together is really important. I mean, if you think about the way they can work together, it can really be transformative. You have like, a Medicare patient who's interacting with Aetna for their health benefit, potentially going to Oak Street for their primary care visit, um, getting a home visit to understand, potential gaps in their care from Signify, working with CVS Pharmacy to get their prescriptions and making sure they're adherent. Like all of that, when you think about what we could do for particular segments and to access to the healthcare system is really meaningful, because I think one of the coolest things about CVS is that our corporate, our alignment to the public good is so powerful. Like we succeed when we keep you out of the hospital and adherent to medication and healthy. And we have all these assets to do it. Now, I think what you're pointing out, and what's the hard part, is how do you show up as one company? Because I think when you have
Mm-hmm.
all these different companies, it can be really difficult to do that because you have different priorities. You're managing to different kind of sets of standards. And I think we're on that journey to do that. And I think we're doing some really interesting things when you think about even prescription fill, where we can fill your prescription at a mail pharmacy, we can fill it at a CVS, we can deliver it to your home via the CVS app. And I think we're driving towards creating those more unified systemic journeys. And another one we're really focused on is our senior journey, looking at consumer segments and trying to see like, hey, these are the things that people who are seniors are experiencing. How can we use all these assets together to bring that to life? And I think you'll like
Mm-hmm.
this one. There's one example here that I just love that I think about all the time. We think about friction in this industry as like things we need to avoid at all costs. Like we know, you think, how many times have you had a conversation about deflecting calls, right? Let's deflect, deflect, deflect. That's a consumer engagement. And one way we're thinking about that is, hey, if we are solving someone's issue, like an issue that they had with their health plan, that's a really awesome opportunity to add value to their healthcare. So could we actually
Mm-hmm.
look at some of our other assets we have available, and not for the purposes of like cross-selling and things like that, but hey, can we actually get them a home visit because hey, this patient would really benefit from one. And taking advantage of that opportunity where we have them engaged to do that is really a critical part of our strategy, and we're starting to do more of that. So I think we're starting to bring it to life, but it is, as you're pointing out, it's a lot of different stakeholders to bring together to kind of face this challenge of how to simplify the healthcare system for consumers.
Sri, let's talk about culture a bit. It's not easy to, you say that you want to create this culture, but then translating that to however many pharmacists you have and all the staff manning the stores, like it's really hard to do. Could you share with us just some of the management strategies or what you're doing to create that customer centric culture on the front line?
Yeah, that's a great question. I think it's the most important thing. I was actually in a conversation the other day about this because you can't have a great consumer experience without a great uh, employee experience. Even if you walk into one of our pharmacies, you can feel the energy in there, right? When it's a really good pharmacy, like people love being around each other. And then you can walk into one that maybe it's not, it's got an opportunity. It'll feel like everyone's miserable to be there. It feels like a fulfillment center, right? So I think we want to build
Yeah.
that first one, that culture. So a couple of different ways. One, I think everything I've said in this call is about how we've solved problems. There are millions of amazing interactions with our frontline colleagues every day, and we inherently, as CX professionals, tend to be, and even operations professionals tend to be really focused on the challenges and solving the challenges. So, can we actually take all that great information we have and celebrate people? So, we've really launched a number of different recognition campaigns, things like sending kudos boxes to frontline employees. We have an app now that gets access to different survey feedback where actually Michelle Peluso, the CMO, Chief Customer Officer, Karen Lynch, others are actually sending notes to frontline employees, congratulating them on delivering great service. we've enabled that to be easy, even, folks in our operations leaders, folks in our store leadership. And then I think the most important one here is we've launched a campaign. It's called Helping with Heart. We worked with the Disney Institute on this to really build a set of what I'd call almost service standards of what the way we want to show up to our consumers and to each other, most importantly. And there's 6 of those standards. I'll share a couple, but some things as simple as like, listening to understand, or greeting someone when you meet them. I mean, how many times you walked in a corporate meeting and no one's even talking to each other until the meeting starts? So we're starting to try to formalize that, because it's things, but unless you practice and talk about them, it doesn't always happen. And I think that's really had a lot of success internally. We've trained almost all of our colleagues. In fact, I think we pretty much have hit all of our colleagues recently in this Helping with Heart mantra, and really trying to bring that to life internally. And I think you have to be you have to be intentional about these things. It's not just going to happen. So you have to build the strategies, to your point, your management routines, to focus on it. So I'd say those are the big ones. Really formalized, make it easy recognition, and then this kind of Helping with Heart service standards are a couple of ways we've taken it on.
Yeah, I think we take for granted the culture of just kindness, of generosity, consideration. When I worked at a Fortune 100 company, it always shocked me when I would go to a big meeting and people were on their computer. They don't really say hi. They're not friendly. It's just like, how is that okay? But it's just people are busy and you can't blame them, but you do almost have to force it. It's not that people are bad, but it's just easy to forget. And if you operationalize these little niceties, I could see how that would be really powerful. Let's talk about digital. Let's talk about technology. So much innovation, even the last year with AI. Tell us about what your audacious goals are for CVS with what you're trying to do with digital. What can we expect to see in the coming few years?
Yeah, I mean, I think one of the biggest ones, which you've, if you look at in the press, even recently, Talak Mindadi's talked a lot about the super app, which is, we're going to bring all of these different assets we talked about into one single digital asset that's going to allow you to access your prescriptions across multiple different CVS properties, and really simple, like a lot of those things I talked about. How do you simplify the experience across all of those things? Um, I think in the CX world, the way we're thinking about some of these things, you know, we talked a little bit about orchestration, but since we have the ability to see the sessions and understand the sessions as people are navigating our sites, can we do things like, hey, when you're having trouble, populate a chat or use AI to even get you the answer to your question? So we're thinking about doing things like that as well. And we're leveraging some of the tools related that you see out in the marketplace to do things like, you know, um, get next best actions to our frontline colleagues, right? So you talked about all the different data sources you have. That can be a lot to cull through, especially if you're like a region director for a store. You're managing, hundreds of thousands, potentially thousands of employees. Um, like, how do you actually understand like what's happening in each of those locations, if you're especially trying to look at all of that different feedback from social, from the survey program, from signals? So can we leverage some of these tools that you see like coming to bear to actually just distill all that down to, hey, these are the 4 things you may want to implement and focus on? So that's the area CX where I think that's where you're going to see a big shift, is these tools that are emerging, these technology tools that you reference, are going to basically shift us from, hey, these are the key themes coming from the feedback, to these are the actions you actually want to take, and kind of scaling like root cause. Like, I have teams of analysts, but like scaling those folks and what they can do to this wide audience of even frontline folks. And I think that's where it's going to be really exciting for us, just from the CX perspective.
Yeah, I mean, anybody can incorporate AI, but how do you know like when it's actually ready to be unleashed on your employees so they
It's a
actually
tough
do
one.
take the next best action?
It's a tough one. I mean, that's like the part that we're really struggling on. What we've kind of decided to do is, a lot of what we're doing is focusing on understanding how to, to your point, help our colleagues and understand the feedback and things like that. We haven't made much of this, like, you want to be careful when you make things customer facing, because all of a sudden when it's customer facing, that person's going to start engaging with it. You got to make sure it's not hallucinating, doing all that stuff that you hear about. But like for us on the feedback side, that change management is critical. right? Because when you start releasing this stuff, you want them using it, you want to use it appropriately. You can see there's real power there, but we're really just scratching the surface right now on like what it can actually do and what are the implications. So you want to make sure those actions are actually in that person's control, for instance, because sometimes this AI will say to you something that that person may not even be able to influence, and you don't want to do that. That can be incredibly disengaging to the employee.
Absolutely. I got it. Let's just close here before we get into the fun rapid fire part. What do you want consumers to think of when they think of the CVS brand?
Well, the first word that comes to mind is trust. I mean, and I think you hear it all the time, but it's so important in healthcare. Like, if you don't trust your healthcare provider, whether it's a pharmacy, whether it's a primary care physician, your insurance company, and nothing else you do matters, right? Because if you don't trust them, then it's just a deterioration of a relationship. We see massive NPS gaps when employees indicate even just marginal declines in trust with us. So we want to be trusted, I think, is number one. And I think the other one I mentioned earlier, I really want us to be a brand that when people think about, they're like, man, I can't live without that company because that company just makes my life so easy and makes it so easy for me to access my care. And so I think the two, for like, I know it sounds a little cliche, but it's trust and ease to me is what we really focus on. And really that start of being a partner in someone's healthcare journey.
I love that. I think that's great. And I think you guys are really doing a great job. So clearly you're moving the needle.
Oh,
I am a
well,
customer. So I
well,
think you're doing a great job.
thank you for your being a customer and your loyalty. And by the way, don't do it on the podcast, but you can tell me what you think on the side. So shoot me an email
I'll
because I
tell you
love.
let me tell you a positive thing that I'll say. Recently, I moved to LA. I relocated my whole family to Calabasas, and I did develop asthma, maybe from COVID, maybe not. I don't know. I had it as a kid. It can come back time to time. And the inhalers, some of the competitors, the pharmacies, they give you these inhalers, they break. They break after like 3 uses. And you're trying to get the medicine out and it doesn't really work. And you're like, darn it, I don't have time to deal with this. And I started ordering my inhalers from CVS. I knew they would be better, and they're better. They don't break. They do what they say they're going to do. I can get the medicine out when I breathe into that little tube. And like that little thing just made my life easier. Aside from the fact when I go to the CVS pharmacy, there's a lot of people working there, and you can tell it's intense because it's busy, but they're moving kind of in synchrony, and there's just a lot of people to help you. So things move quickly as a customer. And for competitors, I would say there's more lines. The pharmacists aren't as excited to see you. It's hard to get help. They don't want to be there. CVS, I would say, is the opposite. You've got an engaged group. But enough
Thank
about
you for
me.
that.
Let's get to know you a little bit better on a personal level. Are you ready for some rapid fire?
I hope so. Let's try it. I'm excited.
I know that just threw a lot at you. Well, all right, let's go. What is the most important part of your morning routine?
Waking up with my kids so my wife can go to the gym. That is a commitment I've
Oh,
made, and I do. You can see them behind me. I got a 4 and a 2-year-old, so we got our hands full.
oh, wow. Yeah, I hear that. And what is one thing that brings perfect happiness to you?
All right, I won't say the kids again because that'll probably be the kid. My family's probably the right answer, but I am a huge sports fan. So other than my children, and this is she's gonna kill me for saying this, and my wife, it's the Pittsburgh Steelers. And when they won the
Uh,
Super Bowl a couple of times, I did feel perfectly happy when that happened. So that's probably the
I
one.
had a bunch of Steelers friends when I lived in New York, and we would go to the bar and like watch the Steelers games. And those
That's
fans are
huge.
like the best fans on the planet. They're very engaged. All right. What show are you currently streaming right now?
Well, we talked a little bit about Presumed Innocent, which you should watch because it's really good. And then
Okay.
I I actually was watching Dark Matter. I think I literally I won't spoil it, but like I think I maybe just finished it or I got a couple more left. But Apple TV is usually our
The
go-to at the
finale is
house.
tonight.
I think
The finale is tonight.
I
So,
got maybe one more to go. Yeah.
all right. And what is one mental health strategy for managing hard days?
I won't say mainlining coffee because I am a huge coffee addict, and I wouldn't recommend that for everybody. That's what I do. I do. I took some executive coaching. That this was great ones I got, which is actually just getting up and moving, which you don't do enough throughout your day. So I have a resistance band over here, so I literally do like a 4 minute resistance workout just in my workloads. And it's amazing how much it just
Mhm.
releases stress because I think we all get stuck sitting all day. Back in your Fortune 100 days before your wonderful customer experience thought leader days, I'm sure you relate to just having to sit at your desk all day. So it definitely winds you up.
Yeah, it's nice to be in charge of your time, but I find a standing desk helps too. What's your favorite type of vacation?
Beach vacation, I'd say. Nothing better than sitting on the beach and watching the ocean. So I'll say beach vacation.
And if you could have lunch with anyone dead or alive, who would it be?
Should I say? I'll say you and win some brownie
Oh,
points. Yes, you, of course. Man, that's a really great question. I don't know. I'll give a lame answer, but I'd say Gandhi. He's a hero in our family, and there's always been a hero in our family. So I think that would be a cool thing, and it would make my
and
parents
if you,
happy.
okay, I think that's a good answer. I wouldn't say that's lame. If you had to describe your outlook in one quick motto, what would it be?
Oh man, quick! You said quick. I think it'll be okay because I think like
Oh,
a lot of people you get caught up in the anxiety, and I tell my team all the time it'll be okay. You're smart people, and if you're smart and you believe in yourself and you believe in the process, you can get through most hard times, and it'll usually be okay.
that is so great. No one has ever said that before. Well, this has been so fun, and I just really appreciate you being here. It means a lot to me. So thank you.
No, thanks for having me.
Everybody, you've been tuning into the Modern Customer Podcast. Until next time. Thanks for watching. Don't forget to subscribe to my YouTube channel or follow me on social media, including Instagram, LinkedIn, X, and more.